Well, certainly we feel that we are cardiovascular disease experts, and not just cardiac, but also the vascular component of that word. And so we deal with the other vessels in the body, not just the heart organ itself. Particularly in interventional cardiology, we have an active role in terms of treating patients with peripheral arterial disease who may have blockages in the arteries going in their extremities and their legs. Technology has allowed us to get into the vascular system even in smaller arteries, such as the arteries in your wrist. And potentially when we're treating peripheral arterial disease, we can even go in arteries in the foot and ankle area. Well, if you notice particularly muscle fatigue, muscle cramping, maybe some weakness in the legs that you haven't always noticed, you're not able to walk as far as you used to, or maybe you can't walk very far at all, those are symptoms to be concerned about. Okay? And some people that come in and say, oh, I just thought maybe I was getting older and I'm not able to do the things I was able to do, but it's not always the case. Maybe those are the signs, the kind of the red flags that says, hey, maybe there's a blockage that has popped up that's reducing blood flow to your muscle, and that's why it's starting to get fatigued and starting to cramp when you try to walk distances. Well, the best prevention is trying to stay away from smoking, from tobacco use, or if you are already smoking, quitting is the best way to prevent further risk for PAD, as well as treating some of the other risk factors such as high blood pressure, diabetes, high cholesterol. Diet and exercise is always up at the top of the list too in terms of prevention. Daily exercise, routine exercise is something that isn't practiced as much as it should by most Americans in terms of getting out there for 30, 45 minutes a day with some sort of activity. Probably say 3 to 4 days a week, and not just kind of being very active at whatever your job is, but actually getting out there and walking or jogging or doing something very active to kind of get your heart beating a little faster and working the cardiovascular system. Sure, so it's a screening event. We invite anyone in the community to come out that day, to sign up first and come out that day. Every individual coming in through the screening test will have a ultrasound done and also having the initial screening test for PAD called an ankle brachial index test done to try to screen for and identify the presence of PAD. It's a great way, free way to come down, take maybe 30 minutes to 60 minutes of your Saturday to come out, get your legs looked at, and either say, hey, your legs look good, or hey, something's concerning here and maybe we need to do some more testing.